Hi, everybody. I'm Tom Goffer from Vaica Medical. We're doing medication adherence. We make sure that patients taking their medications at the correct time. When you're talking about non-adherence, we're talking about patients taking only 50% of the medications. Now, when we think about it, we usually think about our grandmother. Bit Alzheimer, don't remember to take her medications. Unfortunately, that's not the big issue. Everybody have the same results. 4 years ago, we started a study with McGill University in Canada and other hospitals that you can see in the United States. The study was about kids after kidney transplant. Now, when I thought about it, when they actually called me, I thought to myself, hey guys, you don't need us. This is kids after kidney transplant. They will take the medications or their parents will push it with a spoon to make sure they're taking the medications. 3 years after that study began, I know two things. One, they don't take their medications, just like any other case, and that was published on a medical journal. The second thing is our technology helped to increase the adherence by 66% compliance. Now, also mentioned on a public journal, public medications. Now, the big problem, if we're talking about the financial side of it, this is the number that pharmaceutical companies lose every year. Now, they lose it not just because patients are not taking the medication, then buy less medications. They lose that also because if you don't catch that patient at the correct time with the patient support program that comes along with pharmaceutical companies, those patients think that the medication don't work. They do work, but you need to take them. And with a great patient support program that knows when to act at the correct time and give you that small help about your stomach ache problems, about any other problems that you have with your medications, you can increase the time that they're using that medications and improving their health care. Now, how do we do that? We have a very strong cloud infrastructure that helps us to connect to other devices that we tailor-made. A medication dispenser at the patient house. We have a family of them, all connected to the same cloud infrastructure. And the cloud infrastructure is working with an API to connect to the patient support program, to telemedicine companies, HMOs, and pharmacies, and we have that in field. We have two product family, one from chronic patients, and with multi-dose blister packs. That's worth a lot of medications for those patients, and another product family for pharmaceuticals that are designed for a specific and unique medications. For example, hepatitis C, MS, a lot of very expensive medications. To give a number on that, specialty medications usually cost more than $3,000 per month. Our first experience was with MSD, with a treatment for hepatitis C, $82,000 per treatment. So you can understand the value of those medications. This is pictures of our system works. Every device that we have a cellular connectivity inside of it. It's got its own SIM cards, meaning that the patient doesn't need to have any Wi-Fi, internet, or any setup at home. It just transmits the data automatically to our cloud. And we do have an API that helps us to connect to those organizations so they don't need to work only with our software, they can use their software. And we have hospitals, HMOs already working with that program, and obviously patient support program. Now, from the patient point of view, you get a device, the device reminds him when to take the medications without anything, just lighting up the specific device or cell that he needs to take his medication. Now, only if you forget, then you get a text message and a voice alarm to remind you that. You don't want to remind patients 4 times a day. If you do that, day number 5, they throw out the device. And time is up. Questions?
Let's jump some questions.
Thank you very much for your pitch. What about the compliance? Is there any difference between young and older people?
Great question. I would say that there is. If the normal is 50% with young population, we get to 60% on average without the device, and then we increase it by 66%. We get to 96% with pharmaceutical companies, but then we have a patient support program helping on that. So the very important thing is how to connect this device to a patient support program, to somebody at the end of the line. So it's not just digital patient support program. Is the digital side is to make the connections to those care providers.
Thank you for the presentation. I understand the solution. I would be interested, actually, who would be your customer?
Who will be?
Your customer. Who will pay?
So we already have customers. We are revenues on more than 300,000 per year. That's just the beginning of that. It's pharmaceutical companies through their patient support programs. We are just about to sign a very good contract with the Italian patient support program. We have one in Israel and hopefully one in Germany very soon. We have hospitals working with us, and obviously all of those are paying customers. So the customers that I've talked about are paying customers, but the end goal is a patient support program for pharmaceutical companies that have huge populations. Just to give an example of that, if we're talking about, because when you talk about expensive medication, you may think it's a niche. It's not. For most of the pharmaceutical companies, those 50% of the revenues in 2020 comes for those specialty pharmacy. Let's take an example. Humira from AbbVie have 400,000 patients on that very expensive medications every year. And that's just one example from one pharmaceutical company. Pfizer guys here can, I'm sure can tell you about their revenues from those specialty medications that they have.